This teachable moment is brought to you by the Jewish Healthcare Foundation and the Pittsburgh Regional Health Initiative. The VA Pittsburgh Healthcare System had a high readmission rate for CHF patients, so they instituted protocols which successfully reduced it.
What brought you into the hospital last night?
I couldn't catch my breath. I was having a very difficult time breathing.
Well, I had a chance to review your records from the emergency department, and it does look like you've been admitted to the hospital again with congestive heart failure. Fluid on the lungs, fluid on the legs related to the heart, similar to your past admissions.
Congestive heart failure is a disease that affects a great deal of Americans right now. It's probably one of the top 5 readmission diagnoses in the country.
We're going to start some therapies while you're here.
It's a chronic disease that we manage through medications and education for the patient.
Additionally, we are going to have Nurse Karen come in and talk to you specifically about self-management techniques you can use at home to try and prevent similar events from happening in the future.
With congestive heart failure, you never want to gain any more than 3 pounds in one day or 5 pounds in 1 week.
Diet instruction 97%, very, very good.
Staff involvement with these patients has improved the quality of life for these patients and has also decreased the rate at which they have to come back for care.
I think what we have to look at, though, is how do we make that visit realistic? Well, Mr. Massantonio, I'm glad we've gotten you feeling better while you're here in the hospital. We're going to arrange follow-up in primary care clinic within 1 week, and we'd like to see you back in the cardiology clinic within 1 month. Additionally, we've set you up with home telehealth, which we described to you. They'll be installing in your house a scale and electronic blood pressure cuff, which will transmit that data directly back to our nurses here, and myself and your primary care doctor will be able to evaluate those numbers.
Before we started this project, our readmission rate at the Pittsburgh VA was 14.5%. Now our readmission rate is down to 7.5%. Our goal within the next fiscal year is down to 3.0%. We have increased the life expectancy anywhere from 8 to 10 years. We want to improve the patient's quality of life. That's our number one goal at the VA, is to make life better for these veterans. They've given a lot serving for their country.
And it was a pleasure taking care of you.
Thank you, doctor.
Glad you're feeling better.
Thank you.